Hi, I'm Sienna Rodriguez, and I'm going to be talking about my internship with the New American Cities program at Canopy, Northwest Arkansas. So, my official title as an intern was the Community Career Intern, and my preceptor and supervisor was Iris Rahinda, who was the Career Navigator. So I worked for a program within Canopy. So I'm going to be talking about both of their mission statements and their target populations. So Canopy Northwest Arkansas is a refugee resettlement agency. So their mission is to create a community where refugees are welcomed and equipped with all they need to build new lives. The New American Cities program is their community outreach branch of Canopy. So their target population is immigrants already in the community and with work authorization. So the New American Cities program promotes economic empowerment, social mobility, and diverse, inclusive communities through a three-pronged system: pathway building, career navigation, and harnessing the power of champions and coalitions. So these are my two preceptors. These are the two women that I worked closest with. So Iris, who was my immediate supervisor, and Krista Patrick, who was I didn't work directly under, but I did a lot of work for her as well too. So Iris is the career navigator. So her role is very client facing. She does the one-on-one career coaching. She does skill assessment. She communicates with employers on behalf of clients. She does that kind of one-on-one training that those clients need. Krista, on the other hand, she is more community facing. So she establishes pipelines that Iris would help clients get into. She does a lot of networking. She finds opportunities for clients. She finds employment. She works directly with employers to have job opportunities lined up. So my big project, along with playing a supportive role for Krista and Iris with career fairs, events, communicating with clients. I did a lot of managing calendars and helping organize events, as well as calling clients and setting up appointments. But my big kind of overarching project was the NWA training catalog. So when I first started at NAC, New American Cities, they were showing me how they have organized their community resources. And it was a lot of just links here, links there, a binder, a ton of business cards, a bunch of flyers in a drawer, in a binder, in a file somewhere. So what Krista and Iris said that the biggest need was some kind of way for clients to be able to have a good idea of what their opportunities are, to be able to see all these resources in a kind of visually appealing way. So the first half of my internship, I spent gathering these community resources. So going through that binder, going through emails, attending networking meetings to collect all of those educational opportunities to make this catalog. So it's a massive living compilation of free or reduced cost training, upskilling, and educational opportunities in Northwest Arkansas. This resource will help clients have a better grasp of the opportunities available to them. So that first half was just the content, just gathering that, and that document ended up being 27 pages long. So right now it's not quite finished yet, but this is the cover page of it, and it will be the more navigatable, more consumable version of that big, ugly document with all the information. So these are the niche NCHEC competencies and subcompetencies that I've been using and developing while in my internship and in this project. So plan health education and promotion, identify priority populations, partners, and other stakeholders, apply principles of cultural competence in selecting and design. So when it comes to this project, a lot of the information we already had was based on opportunities and employment placements that we had for previous clients. So you could kind of see a pattern arise in what kind of jobs, what kind of skills and educational needs that our clients typically come in with. So this catalog is very geared to the average client. So it has a lot of just pipelines that we use, a lot of educational opportunities that would be most accessible to them, typically. And it is written, the whole document is written in pretty remedial English, like very easy to understand elementary English, as our clients, they are required to come in with only conversational English. So their level of fluency can vary. So we want this to be a document that's very accessible. Administrator and manage health, education, and promotion. Use technology to collect, store, and retrieve program management data. Recruit staff members and volunteers for program. So as an intern, there is also an administrative side on top of this kind of overarching project. So you are working to manage clients. We have a huge client database where we kind of keep their cases, keep track of important documents, and notes that we take at each meeting, as well as Canopy is wanting to join many referral programs. So a lot of what I'm working on the latter half of my internship is helping my preceptor join these referral programs. So it's about 6 or 7 programs, and it's a very long process to join these referral sites. So they're also huge databases that I help input the information and manage, as well as recruit staff members and volunteer for the program. So we're doing a lot of career fairs, a lot of client recruitment, always plugging. We're doing a lot of meeting with people to help get the word out there, because it's a really incredible program and it does a lot of good, but it's really new. It's about 2 years old as of 2023. So a lot of what I do is the recruitment, the kind of plugging side of NAC. So what I personally gained from this experience was I became a more confident public speaker. I got put into a lot of spaces where I need to have an elevator pitch, where I got to talk in front of a lot of people about the program, what I do within the program, what Iris and what Krista does within the program. So I became more comfortable kind of in that situation. I also improved my emailing skills. I kind of went in, I was very confident in my emailing skills, and the first couple emails I sent, my preceptors were like, hey, it needs to sound more general. It needs to sound like us. You need to be able to mimic what we talk like, what we sound like, what these emails are, because you're communicating on our behalf. So a lot of email practice. I got to do a lot of drafts. So I got to improve those email skills. I learned how to conduct interviews. I got a lot of networking experience. We attended a lot of networking projects. I learned a lot about economic barriers in Northwest Arkansas. That was my main goal, my main educational goal going into this. In public health, we tend to focus on some of the genetic and social determinants of health, more biological. And we talk about the economic, socioeconomic factors in the determinants of health, but it's different to kind of see it in person, to see what that looks like, where those barriers are and how they pop up and how they affect people's lives. So that was kind of the one facet that I really wanted to become more familiar with. And then what my agency gained. So that training catalog is probably my largest contribution. The goal is for that to be used for many years to come and to help many clients. So that was probably my biggest contribution, as well as I create a lot of flyers, a lot of cards, a lot of documents, just kind of doing soft marketing for NAC, as well as I'm the first intern that the NAC program has had. They've only been around for 2 years, and they've only been requesting interns for about a semester now. So I've been able to establish that role of intern, clearly define what the tasks are, what the jobs are, what the responsibilities are, as well as establishing the emails and passwords and kind of all the groundwork that having a new role kind of entails. As well as I've recruited clients and helped establish community partnerships. Between me and Iris, we attended a lot of community events, and I've done some on my own as well. And that has also brought, clients and community partners to the program. So that is New American Cities at Canopy. So on the screen is just the address, the phone number, the website, as well as some of the people you'd be directly working with. Sadly, two of those people are leaving or have left. Krista left about a month ago, and Iris will be leaving in May. So the only person would be Holland still there. But it's a great program, and I think it is a great choice for anyone interested in learning about economic development in public health.